እሺ ዛሬ የምናየው ስለ ሃይፐርቴንሽን ነው። በዋናኛነት ሃይፐርቴንሽንን አንደርስታንድ ማድረግ ነው። ሶ አንደርስታንዲንግ ሃይፐርቴንሽን hypertension means high blood pressure. It is a chronic medical condition in which the systemic arterial pressure is persistently elevated. So hemodynamically, blood pressure is determined by cardiac output and systemic vascular resistance. BP equal to cardiac output times systemic vascular resistance. There are two types of hypertension, namely primary and secondary hypertension. Another name of primary hypertension is essential hypertension. It accounts for 90 up to 95% of clinical cases, and it's multifactorial with no single identifiable cause. When we look to the secondary hypertension, 5 up to 10% of the cause, which is caused by underlying conditions such as renal disease, endocrine disease, or it may be caused by drugs. When we talk about blood pressure categories, there are 5 types of 5 categories of blood pressure: normal blood pressure, elevated blood pressure, stage 1 hypertension, stage 2 hypertension, hypertensive crisis. These are BP categories. The normal, when we say blood pressure is normal, systolic blood pressure is less than 120 and 120, and the diastolic blood pressure is less than 80. And when we say blood pressure is elevated, the systolic is 120 up to 129, and the diastolic blood pressure is less than 80. When we say stage 1 hypertension, the blood pressure or the systolic blood pressure is 130 up to 139, and the diastolic blood pressure is 80 up to 89. When we say stage 2 hypertension, the systolic blood pressure is 140 or higher, or the diastolic blood pressure is 90 or higher. And when we say hypertensive crisis, it is the highest blood pressure reading higher than 180, the systolic BP, and it's greater than 120, the diastolic blood pressure. When we see about the pathophysiologic mechanism of blood pressure, it may be caused by symptomatic overactivity, it may be caused by RAS dysregulation, vascular remodeling. Mostly blood pressure is elevated because of these 3 factors. When we say about systemic symptomatic overactivity, excessive symptomatic nervous system drives increase the heart and the cardiac contractility while inducing systemic arterial vasoconstriction. When we say about RAS dysregulation, inappropriate activation of RAS system leads to renal sodium and water retention alongside vasoconstriction. The third thing is vascular remodeling. Chronic wall stress, which causes arterial stiffness, endothelial dysfunction, and reduced nitric oxide bioavailability, exacerbating peripheral resistance. When we say about the key etiology and the risk factor for BP, it may be caused by 2 things: non-modifiable and modifiable risk factor. Non-modifiable risk factor, when we say about non-modifiable risk factor, the first thing is advanced age, progressive arterial stiffening, and the loss of vascular compliance over time because of aging. The second non-modifiable risk factor is family history and genetics. Polygenetic background influencing sodium handling and vascular tone. The third non-modifiable risk factor is ethnicity. There is higher prevalence and severe disease trajectory in specific demographic population. The second risk factor is modifiable risk factors. Among the modifiable risk factors, high dietary sodium, excess salt intake leads to fluid retention and plasma volume expansion. The second thing is obesity and inactivity. Increase in insulin resistance that may cause symptomatic tone and increase vascular stiffness. As a result, it may elevate BP. The third modifiable risk factor is tobacco and alcohol use. It induces acute vasoconstriction and chronic endothelial damage. When we say about silent symptom, the symptom is the silent killer. Most of the time, hypertension is the silent killer because it is usually asymptomatic until significant vascular damage has occurred. And BP means sustained high arterial blood pressure causes irreversible microvascular and macrovascular injury across the organ system. It may cause the heart, it may cause the brain, and it may cause the kidney and the eyes to be damaged. When we say about clinical evaluation and diagnosis, standard BP measurement requires rest for 5 minutes, correct cut size at heart level and average. When we say about management treatment, the first thing is lifestyle intervention, dietary approach to stop hypertension. That means rich in potassium, calcium, and low sodium. That means less than 2,300 milligram per day. The second lifestyle intervention to manage hypertension is physical activity. Almost more than 150 minutes per week of moderate intensity aerobic exercise is best to manage and treat hypertension. The third thing is weight management. Target body mass index of 18.5 up to 24.9 kilogram per meter square. Expected BP reduction is 1 millimeter per kg lost. When we say about pharmacotherapy, the most common medication which are used to treat manage BP is ACE inhibitors or angiotensin receptor blockers. ACE inhibitor and angiotensin receptor blockers are the first-line agent, which are particularly beneficial in patients with renal disease or diabetics. The second most important antihypertensive medication is calcium channel blocker, which is effective vasodilators, which are widely used as initial monotherapy or combination. The third thing is thiazide diuretics. Thiazide diuretics reduce intravascular volume and systemic vascular resistance over time. Thank you. If you have any question and discussion, you can ask, and you have to comment.